How to avoid colon cancer. What is colon cancer? Colon cancer is a type of cancer that begins in the large intestines. When the rectum is involved, it's called colorectal cancer. It is estimated that the number of colorectal cancer cases in the United States for 2022 are 106,180 new cases of colon cancer and 44,850 cases of colorectal cancer. It is estimated that colorectal cancer is the third leading cause of cancer-related deaths in men and women, and it is the most common cause of cancer deaths in all genders. You might be wondering, how does it develop? Well, before we dive in, welcome to Healthier Life, a channel where we talk about your health to help you live healthier life. If you like content like this, it will help this channel a whole lot. If you like this video, and subscribe to this channel if you like content like this. Now, let's move on. Colon cancer begins when healthy cells in the colon develop changes in their structure, also known as their DNA. If you recall from science, a cell's DNA contains a set of instructions that tell a cell what to do. Instructions from a healthy cell lead to the production of more healthy cells, but instructions from a damaged cell will lead to the production of more damaged DNA cells. When a cell's DNA is damaged and becomes cancerous, cells continue to divide, even when new cells aren't needed. As the cells accumulate, they form a tumor. These cancer cells often grow to invade and destroy normal tissue nearby. What are the symptoms of colon cancer? Persistent abdominal discomfort such as pain, cramps, or gas, rectal bleeding or blood in the stool, a persistent change in your bowels such as having diarrhea or constipation or change in the consistency of your stool, unexplained weight loss, weakness or fatigue. Sometimes you may feel that your bowels do not empty completely, and also you might not have any symptoms of colon cancer when it is in its early stages, but cancer cells can grow to invade and destroy normal tissue nearby in other parts of your body. Now, let's look at who is at most risk for colon cancer. First, family history of colon cancer. Having blood relatives who have had colon cancer puts you at risk for colon cancer. 2. Older age. Research has shown that adults age 50 and older are at risk for developing colon cancer, even though you can get colon cancer at any age. 3. Inflammatory intestinal disease. Diseases such as ulcerative colitis and Crohn's disease can increase your risk for colon cancer. 4. Having a confirmed or suspected hereditary colorectal cancer syndrome, such as familial adenomatous polyposis or Lynch syndrome, puts you at risk for colon cancer. 5. Diet. Research is showing that eating a low-fiber and high-fat diet is a risk factor. Eating foods such as red and processed meats puts you at risk for colon cancer. 6. Diabetes. This is a chronic condition in which the pancreas produces little or no insulin. This kind of condition can predispose you to colon cancer due to the changes that occur in the body. 7. Smoking. I know a lot of people know smoking to be famous for lung cancer, but it can also put you at risk for colon cancer. Studies have shown that people who smoke tend to develop larger and numerous colon polyps. If these polyps are not removed, they can easily become cancerous. 8. Living a sedentary lifestyle that leads to obesity can put you at risk for colon cancer as well. Studies have shown that people who are obese are 30% more likely to develop colorectal cancer or colon cancer than the normal weight people. Obesity has been linked to worse cancer outcomes, such as reoccurrence of primary cancer or mortality. For more details about this research, the link is in the description below. I have added more links to my other videos about how you can avoid obesity. If you're interested in content like this, do not forget to like this video and subscribe to this channel. 9. African Americans are at greater risk for developing colon cancer than people of other races. Studies from the American Cancer Society show that African Americans are about 20% more likely to get colorectal cancer and about 40% more likely to die from it than most of other groups. You can read more about this using the link in the description below. Do not forget to leave me a comment. 10. Alcohol. Research has shown that use of alcohol accounts for 6% of all cancers and 4% of all cancer deaths in the United States. This has been found to be more common in men than women. 11. Abdominal or pelvic area radiation treatment to treat other types of cancers can increase your risk of developing colon cancer as well. What are the treatments for this type of cancer? Surgery can be done to remove the tumor. Radiation therapy can be used to destroy the cancerous tissue. Chemotherapy can be used to kill the cancer cells. There is also targeted therapy to keep cancer from growing and spreading. How can you prevent colon cancer in the first place? The American Cancer Society recommends that people who are at average risk of developing colon cancer should start screening at the age of 45. People over 85 should no longer get colorectal cancer screening. There are different test options for colon cancer or colorectal cancer, such as stool-based testing. One of the popular ones is cologuard, which is the multi-targeted skull DNA test. This is supposed to be done every 3 years. A kit is sent out to your home and you put a sample of your stool and send it back in the kit. There are also visual exams of the colon and the rectum as well, such as colonoscopy, which can be done every 10 years depending on the results of the previous one. There is also the CT colonoscopy every 5 years. There is also the flexible sigmoidoscopy every 5 years. Screening can lead to early detection of polyps, which can be removed to prevent tumor growth. The following ways can help you reduce your risk of colon cancer. Get screened for colon or colorectal cancer if you're over 45 years of age. Maintaining a regular exercise at least 30 minutes daily will help you lower your chances of getting colon cancer. Maintain a normal weight. If your BMI is greater than 25, lose weight. Do not smoke. This can be hard if you're already smoking, but reach out to your doctor if you failed to quit smoking. If you want me to post a video about how you can stop smoking, comment down below. Lastly, eat lots of vegetables, fruits, and whole grains. Cut back on red meat and processed meats, as these have been linked to colon cancer. Avoid alcohol. Remember to like this video and subscribe to this channel if you like content like